So the IMforte trial was a global open-label randomized phase 3 study that investigated the efficacy and safety of lurbinectedin in combination with atezolizumab as compared to atezolizumab alone for the maintenance treatment of those patients with extensive stage small cell lung cancer whose disease did not progress after first-line induction treatment with atezolizumab plus carboplatin plus etoposide. So in summary, was the study evaluating the role of the combination of lurbe plus atezo as first-line maintenance treatment for extensive stage small cell lung cancer. Okay, so in this randomized trial, it was clinically relevant improvement that, of course, was also statistically significant in terms of PFS for those patients treated with the combination of lurbe plus atezo as compared to atezo alone, with a hazard ratio of 0.54 and a p-value of 0.0001. That means a decrease in the risk of progression along the study period of 46%. This translates into an increase in median PFS from 2.1 months to 5.4 months, and I think that's pretty significant. There was also a consistent increase in the other primary endpoint of the survival that was clinically meaningful with a hazard ratio of 0.73 and a significant p-value of 0.0174. That translated into an improvement in median OS from 10.6 months to 13.2 months in the lurbe plus atezo combination. I have to say here that in that trial, because it's a maintenance study, we started to measure survival from the time of starting maintenance treatment after 4 courses of induction treatment. So since diagnosis, already 3.2 months had already elapsed. The other thing I have to comment in terms of results is that the safety profile of the drug of the combination was predictable. So we didn't find any new signal. Of course, there was some more side effects in those patients treated with lurbe plus atezo. For example, there were most of grade 3 or 4 treatment-related adverse events, 26% as compared to 6%, but the treatment-related grade 5 events were very similar, 0.8% and 0.4%, and the impact in treatment discontinuation was quite low, 6.2% of the patients in the combination as compared to 3.3% on those patients treated with atezo. Finally, I have to remark that there was not an increase in any immune-related side effects. So for me, given the statistically significant but also clinically meaningful improvement in OS and PFS, and taking into account the safety profile of the combination, I think the IMforte combo of lurbe plus atezo is having the potential to become the new standard of care for those patients with first-line maintenance therapy in this very aggressive and difficult to treat disease of extensive stage small cell lung cancer, because I truly believe those patients are benefiting from this therapy. Of course, not every single patient is going to be candidate. For example, in this trial, we didn't include patients with brain metastasis at diagnosis, but for most of the patients where we do not foresee a contraindication, is going to be a good alternative.